5 health checkups that you might want to avoid after you turn 70. They could end up doing more harm than good. There's a truth out there that a lot of older folks just never hear from their doctors. Every year, you've got millions of senior citizens lining up for their health checkups, thinking they're being proactive and staying healthy. But what if I told you that some of these tests, you know, the routine ones your doctor tells you are essential, could actually be nudging you closer to needing surgery, suffering a stroke, or even developing cancer? Recent studies are showing that as many as 37% of medical tests performed on older adults lead to treatments that weren't really needed, complications or side effects that stick around for life. And it's pretty shocking. Something like 99% of people over the age of 70 have no idea that they're being overtested. One of these checkups, the one that's at the very top of our list, is actually responsible for about 5% of all cancer cases in the United States. That's about the same number of cases that are caused by drinking alcohol every single day. You're probably not going to hear this information at your local clinic. You definitely won't see it plastered on a billboard, but the truth is actually buried within the scientific data. And today we're going to bring it all to light. In this video, we're going to talk about those 5 health checkups that you should probably avoid once you're past 70, and the seriously scary truth about what they can potentially do to your body. This is all backed up by solid science, and you won't believe what made it to the number 2 spot. Before we dive in, let us know in the comments section where you're watching from, what your age is, and if you've ever regretted having a particular test or procedure done. Do you think that senior citizens are being tested too frequently these days? We're reading and responding to every single comment, offering personalized tips and advice. And of course, don't forget to hit that like button and subscribe to our channel so you do not miss out on more videos like this. Now, without any further delay, let's jump right into talking about the first test. We'll cover why it might seem harmless on the surface, but how it could actually be quietly chipping away at your quality of life. Number 5, the bone density scan. It sounds pretty innocent, right? A quick scan, no pain involved, no needles, and you walk out knowing whether your bones are at risk of breaking. But here's the thing that they often don't tell you. After the age of 70, a bone density scan can frequently create more anxiety and worry than it provides any real benefit. This scan, which is officially known as a DEXA scan, is designed to measure just how strong your bones actually are. It's primarily used to help detect osteoporosis, which is a condition that weakens bones. But in older adults, especially women, the results almost always come back showing lower bone density, even when there isn't a real significant danger. That's simply because bone loss is a completely natural part of the aging process. Just like getting wrinkles or your hair turning gray, it's something that happens to pretty much everyone as they get older. And yet, a lot of older folks are pressured into taking medications like bisphosphonates, which are supposed to help strengthen bones, but they often come with some pretty serious side effects, such as jaw necrosis. That's a relatively rare but very serious condition where the jawbone actually starts to die. These medications can also cause irritation to the esophagus. Now here's where the real problem lies. Studies have demonstrated that treating mild bone loss in people over the age of 70 with medication often has little to no noticeable impact on actual fracture rates. A study that was published in the Journal of the American Geriatric Society followed more than 200 women over the age of 70. It found that bisphosphonates only reduced the risk of fractures by about 0.3% after a full 5 years. I mean, that's better than nothing, but it's certainly not a life-saving amount. Instead, those women were actually far more likely to experience negative side effects from the medication, including digestive problems, inflammation in the esophagus, and even brittle bones that were prone to breaking in unusual ways. Let me tell you about Rose. She was a 76-year-old retired piano teacher who was sent to get a DEXA scan after her yearly checkup. She'd never fallen, she wasn't experiencing any pain, and she took walks every single day. Her scan came back showing osteopenia, which is basically a mild reduction in bone density that isn't actually considered to be osteoporosis. Her doctor immediately started her on alendronate, which is a common bisphosphonate medication. Within 3 months, she had developed severe acid reflux and pain in her jaw. By the time she came to see us, she hadn't played the piano in weeks. We took her off the medication and started her on a new routine that included vitamin D supplements. weight-bearing exercises like using resistance bands, and a diet that was rich in calcium, with foods like sardines and leafy green vegetables. A year later, she was back to performing recitals, with stronger legs, better balance, and 0 fractures. A quick scan might seem like a smart and proactive move, but for people who are over 70 and aren't falling or breaking bones, focusing on lifestyle changes is generally a much better option. Strength training, exercises that improve balance, proper nutrition, and treating any vitamin D deficiencies have all been shown to reduce fractures by over 20%, according to a study published in Osteoporosis International in 2022. Do not let a number that you see on a screen scare you into starting a treatment that you might not even need. But there's another type of scan out there that can potentially lead to something even scarier: brain surgery. So let's talk about that next. Number 4. Brain MRIs for memory loss. When older people start to feel a little more forgetful or confused, their natural reaction is often fear. They're afraid of dementia, afraid of Alzheimer's disease. So, doctors often respond by ordering a brain MRI. But here's a slightly uncomfortable truth that we need to address. MRIs, which are detailed scans that provide a view of the structure of the brain, very rarely provide the answers that patients are really hoping for. In fact, most MRIs that are performed on people over the age of 70 simply show age-related changes. This could mean slight shrinkage of the brain or some white matter spots. These are both totally normal things that happen as people get older. But here's the really important part. Once those spots are actually seen on the scan, they can trigger a whole chain reaction of fear, additional tests, and potentially even surgery. Surgery that might not even improve memory and could actually end up making things worse. In 2021, a study that was published in Neurology Today reviewed over 3,000 MRI scans that had been performed on patients between the ages of 70 and 85 who had reported experiencing mild cognitive issues. 86% of those scans showed some form of abnormality in the brain, but only about 3% of those findings were actually linked to a treatable condition. That means that 97% of the people went through the emotional stress of hearing that there was something wrong with their brain, when in reality, there really wasn't. Even worse, nearly 12% of those people were sent to have invasive procedures, such as spinal taps or even exploratory biopsies. All of this was based on scan results that were fairly vague. Let's talk about George. He was a 74-year-old retired engineer who came to see us because he was concerned about his forgetfulness. He was still pretty sharp, but he was misplacing his keys more often and sometimes forgot people's names. His doctor sent him to get an MRI, and the scan showed white matter changes in his brain. He completely panicked, and he became convinced that he was developing dementia. He stopped driving his car, and he even stopped going to church. Over the next few months, his anxiety got even worse, but when we re-evaluated him using a standard cognitive test, his score was well within the normal range for someone his age. We explained to him that the MRI findings were consistent with what we would expect to see in someone of his age. We helped him to focus on lifestyle interventions, such as improving his sleep, staying properly hydrated, and playing brain training games. Within about 3 months, his memory had stabilized and he was feeling like his old self again. The truth is, unless you're experiencing severe neurological symptoms such as seizures, a sudden change in personality, or a rapid decline in your ability to function, an MRI is rarely helpful in cases of mild memory loss. A much better first step is to do a cognitive screening test. This is basically a simple paper-based exam that evaluates your memory, your attention span, and your problem-solving skills. It's inexpensive, it's effective, and it helps you avoid the risk of experiencing unnecessary panic and anxiety. Now, brace yourself, because the next test on this list is one that you've probably had done multiple times in your life, and there's a good reason why it's number 3 on our list. Number 3, the cardiac stress test. It's one of the most common tests that are given to older people who are complaining about mild fatigue, tightness in their chest, or just not feeling quite like they used to. The cardiac stress test, which is a procedure where they monitor your heart while you're walking on a treadmill, or while you're being given medication that simulates the effects of exercise, is intended to help spot blocked arteries. But after the age of 70, this test often does more harm than good. particularly when it's used on people who don't have any clear signs of heart disease. That's because it can often lead to false alarms and unnecessary heart procedures, which carry some pretty serious risks. The problem really comes down to accuracy. Studies show that in adults who are over the age of 70, the false positive rate for stress tests, meaning that the test indicates that there's a problem when there really isn't one, can be as high as 40%. This can lead to follow-up tests, such as angiograms and even unnecessary stent placements or bypass surgery. In 2017, a major study that was published in JAMA Cardiology found that more than half of all stents that were placed after stress test referrals were done in patients who had no real symptoms or benefit from the procedure. Those patients didn't experience any improvement in their survival rates or their quality of life after the procedure. What they did experience, however, were higher rates of bleeding, kidney injuries from the contrast dyes that were used, and prolonged hospital stays. This actually happened to Raymond. He was a 75-year-old retired postman who made sure to stay active by walking every day. During a checkup, he mentioned that he sometimes felt a little tired when he was walking up hills. His doctor scheduled a stress test, just to be sure. The results of the test were a little unclear, so he was sent to get a catheterization. This is a test where they insert a tube into the arteries to check for any blockages. They found a mild narrowing, and a stent was placed to open it up. But that same night, Raymond had a bad reaction to the contrast dye and he developed kidney problems. He spent 6 days in the hospital, and he needed follow-up care for several weeks after that. His fatigue never really went away, because it wasn't even a heart problem to begin with. He was simply an older man who needed to drink more fluids and get more rest between his meals. If you're over the age of 70, and you're not experiencing classic cardiac symptoms such as chest pain during activity, shortness of breath when you exert yourself, or a significant drop in your energy levels during light exercise, then a stress test might end up doing more harm than good. A better option is often a resting EKG, which is a test that looks at the heart's rhythm while you're at rest. Or you could even consider getting a coronary calcium scan, which is an imaging test that uses low levels of radiation to show whether dangerous plaque is building up in your arteries. These are safer, simpler, and far less likely to push you into undergoing a procedure that you don't actually need. Number 2, colonoscopies. You probably weren't expecting to see this one on the list, but a colonoscopy, which is a procedure that involves using a long camera to examine your colon, isn't always a wise choice after the age of 70. It's almost never recommended after the age of 75, unless there are some specific symptoms that are causing concern. The risks associated with the procedure tend to increase as you get older. The preparation for the procedure is pretty harsh. It involves taking strong laxatives, which can lead to dehydration, dizziness, or even kidney problems. The sedation that's used during the procedure can also pose added risks to brain function in older adults. And perhaps most surprisingly, the test itself can actually cause complications, such as bleeding, tearing, or even disturbances in your heart rhythm while you're sedated. A study from 2019 that was published in JAMA Internal Medicine followed more than 1.3 million Medicare patients who were age 70 and older. They found that for every 1,000 colonoscopies that were performed on patients over the age of 75, only about 2 lives were saved, but more than 20 people experienced serious complications. That's a risk-to-benefit ratio of about 10 to 1. And even when polyps are found during a colonoscopy, many of them are small and slow-growing. Removing them in an older adult can sometimes do more harm than simply leaving them alone. Let's talk about Dana. She was a 73-year-old grandmother who ran a small bakery with her daughter. She wasn't experiencing any symptoms, no bleeding, no changes in her stool, and she had no family history of colon cancer. But her new primary care doctor, who was fresh out of her residency, strongly urged her to get a screening colonoscopy. She agreed to go ahead with it. During the procedure, a small polyp was removed, and she was sent home. That night, she experienced intense abdominal pain, and she ended up fainting. When she got to the hospital, they discovered that she had a bowel perforation. She spent 9 days in recovery, lost about 10 pounds, and she really hasn't been the same since. When we looked back at her case, we saw that she had already had 2 clean colonoscopies in the past. There really wasn't any reason for her to repeat the procedure. The U.S. Preventive Services Task Force currently recommends that people stop getting routine colon cancer screenings at the age of 75. For those who are in excellent health, a stool-based test such as the FIT test is often a much safer option. The FIT test is a non-invasive fecal test that can be done at home. There's no prep involved, no sedation is needed, and it still manages to catch most of the concerning cases. Be sure to ask your doctor about potential alternatives, because once you're in the colonoscopy pipeline, it can be pretty difficult to get out. And now, we've finally reached the most overused, the most dangerous, and the most harmful checkup for senior citizens. You've almost certainly had it done at some point in your life. Number 1. The annual full-body CT scan. Full-body CT scans, which are sometimes offered as part of executive health packages or as preventive services in private clinics, are often marketed as a way to catch cancer in its early stages. But here's a pretty shocking truth that you should know. These scans expose your body to a pretty high dose of ionizing radiation. For older adults, particularly those who are over the age of 70, the risk of triggering unnecessary follow-up tests, biopsies, and even surgeries is incredibly high. And the really ironic thing is that there's absolutely no evidence that full-body scans without any existing symptoms actually save lives. Each scan delivers somewhere between 10 and 20 millisieverts of radiation. That's about the same amount of radiation that you would get from having around 500 chest X-rays. According to a modeling study from 2023 that was published in JAMA Internal Medicine, the increase in the number of CT scans being performed across the United States may now be responsible for as much as 5% of all cancers. That basically puts them on par with alcohol as a factor that causes cancer. That means that roughly 1 out of every 20 cancers could be caused by a scan that was supposed to prevent the disease in the first place. That's not just counterproductive, it's downright terrifying. The scan can detect harmless nodules, calcifications, or cysts that are simply a normal part of the aging process. But the moment that they're seen on the scan, it raises a red flag. This leads to more scans, then biopsies, and ultimately a lot of unnecessary panic. Let's talk about Marcus. He was an active 80-year-old who used to teach martial arts to other senior citizens. He was feeling great, and he decided to take part in a senior elite checkup at a private clinic. His full-body scan showed a tiny 3mm nodule, and that set off a whole chain reaction. He was referred to an oncologist, sent to get a PET scan, and eventually he underwent a needle biopsy. The result of the biopsy was benign, but the procedure ended up collapsing part of his lung. This led to him being hospitalized and needing 2 months to fully recover. All of this was for something that could have simply been left alone. Experts now advise that full-body CT scans should never be used for general screening purposes in adults who aren't experiencing any symptoms. The American College of Radiology has been very clear about this. They say that there's no proven benefit to doing these scans, and there's a significant potential for harm. If you're experiencing symptoms, such as unexplained weight loss, coughing up blood, or visible swelling, then targeted imaging can make sense. But scanning your whole body without having a specific focus is kind of like searching for buried treasure with a landmine detector. You might find something, but the damage that it causes could end up being far worse than what you were trying to avoid in the first place. A safer and smarter approach is to simply listen to your body. If you're feeling well, continue to have regular checkups with your primary care doctor, and only agree to do tests that are clearly indicated based on your symptoms and risk factors. Your time, your energy, and your health are all far too valuable to waste on fear-driven screenings that could potentially leave you in a worse state than you were in to begin with. So there you have it. Those are 5 checkups that might seem like they're helpful, but they can actually end up hurting you, especially once you're past the age of 70. Modern medicine is extremely powerful, but it's definitely not perfect. Sometimes less is actually more. Always ask yourself, what happens next? If a test ends up finding something, if the answer is unclear, or if the risks of doing the test are higher than the potential rewards, then it might be time to pause and reconsider. And remember that true prevention always starts with your lifestyle. Stay active, eat nutritious foods, get plenty of sleep, and be sure to choose your checkups wisely. Now, we'd really like to hear from you. Have you or someone you know ever experienced complications from a medical test or treatment that turned out to be completely unnecessary? What exactly happened? Please share your experiences and opinions in the comments section below. We'd really love to hear what you have to say. Thanks for watching.